Next is sebaceous glands. Now these sebaceous glands, they are generally present along with hair follicle, and when they are present along with hair follicle, we call them pilosebaceous unit. But sometimes they are present alone, and when they are present alone, we call them ectopic sebaceous glands. So along with hair follicles, these are known as pilosebaceous unit. When they are present alone, we call them ectopic sebaceous glands. One common disorder of pilosebaceous unit is acne. Acne vulgaris, that is the most common type of acne. Another disorder is rosacea. While these ectopic sebaceous glands can be present over various sites like lips, over lips they are known as Fordyce spots. Over glans penis, over glans they are known as Tyson glands. Over areola, Montgomery tubercles. And in eyelid, Meibomian glands, gland of Zeiss. In eyelid, you might have read about gland of mole as well, but remember that these are not sebaceous, these are apocrine sweat glands. Similarly, breast, they are modified apocrine sweat glands. Similarly, ceruminous glands present in external auditory canal are also modified apocrine sweat glands. So sometimes they ask you that gland of mole, breast and ceruminous glands, so they are what? They are modified apocrine sweat gland, while Meibomian gland, gland of Zeiss, these are ectopic sebaceous glands. Similarly, Montgomery tubercles, Tyson glands and Fordyce spots. Many a times students get confused between Fordyce and Fox Fordyce. So remember, Fordyce is sebaceous while Fox Fordyce is apocrine. Okay. So here in this image you can see that this is one of the sweat glands, and in this sweat gland it has two portions. This is the coil portion, this is the duct portion, and this duct is directly opening over the skin surface. So this is what? This is eccrine sweat gland. While this is again another duct, this is the coil portion, this is the duct portion, and this duct is opening along with the hair follicle. So this is apocrine. So eccrine directly opens over the skin surface, apocrine opens along with the hair follicle. One of the disorder of eccrine sweat gland is hyperhidrosis. Many a times this occur over palm and sole. So this is also known as palmoplantar hyperhidrosis. Then malaria rubra, this is the most common type of malaria, commonly known as prickly heat, where these erythematous papules start developing, and they are due to blockage in the duct of eccrine sweat gland. Fox Fordyce disease is disorder of apocrine sweat gland. Most common site is axilla. Over axilla you will find these itchy papules. They are commonly seen in females in their second decade. These itchy papules develop over axilla. This is Fox Fordyce disease. There is one more condition. This is also a disorder of apocrine sweat glands. Hidradenitis suppurativa. Here also the most common site involved is axilla. This usually presents with multiple nodules with scarring and interconnecting bridges. So multiple nodules, and they heal with scarring, and there might be interconnecting bridges between them. Okay. And there are different stages where initially only nodule is present, then scarring is present, and then interconnecting bridges might be present. So various stages are there. In the initial stage or the stage 1 where only nodules are present, there you can treat with medical treatment, like we can give isotretinoin, doxycycline, and later on we require surgical treatment. So you might read this disorder in surgery in detail. So generally surgical treatment is required, but initially in the initial cases in the stage 1 where only nodules are present, you can treat with medical treatment like isotretinoin, doxycycline, and there is one biological drug also that is adalimumab, which is approved for use in hidradenitis suppurativa, which is also used in psoriasis. Now remember, this is a very rare disorder. This is also a disorder of eccrine sweat gland, and here the patient develops these skin colored raised lesions. They are generally asymptomatic. They generally develop over, so common site is around eyelids. And these are what? These are benign eccrine sweat duct tumors. These are known as syringomas. Okay, so syringomas, they are generally skin colored raised lesions around eyelids. Sometimes you might get confused with warts or acne, but this is a very rare condition, and this is due to sweat duct tumors. Okay. Similarly, there are few more rare conditions of eccrine sweat gland. This is also eccrine. Then another condition is hydrocytoma and neutrophilic eccrine hidradenitis. Hydrocytoma is due to blockage of eccrine sweat glands. Here also the duct is blocked, while neutrophilic eccrine hidradenitis is due to chemotherapy. When the patients undergo chemotherapy, there is lot of neutrophilic infiltration which occurs in the eccrine sweat glands, and this eccrine hidradenitis, that is inflammation of the sweat glands, might occur. Okay, so these are three rare conditions of eccrine sweat glands. If sometimes they appear in the option, you can very easily answer them. Syringomas, these are the sweat duct tumors. Similarly, hydrocytoma is also due to blockage in the duct of the eccrine sweat gland, and here also this is the benign tumor. And then swelling or inflammation in the eccrine sweat gland, this is due to after chemotherapy, which develops neutrophilic eccrine hidradenitis. Then sebaceous gland, I told you, these Fordyce spots, these are ectopic sebaceous gland, generally develop over lips, sometimes might be present over buccal mucosa. You can see these lesions which are present here. So let us first discuss about rosacea. Okay, now whenever question is asked on rosacea, you can very easily answer these questions if you just remember these three important points. The first one is site. Convexities or convex areas of face are involved. Second important point, associated with, this is usually associated with flushing. Clinical presentation, erythrotelangiectatic. See, there are different types of rosacea. Among them, the most common type is erythrotelangiectatic. So clinically, it presents with erythema, that is erythema, with telangiectasia, that is the superficial dilated blood vessels. This is the most common type. So this is the most common presentation which is seen. But there are few rare types also. Like one of the type is papulopustular, then phymatous type. So in papulopustular, you will get papules and pustules. In phymatous type, you might get rhinophyma and ocular. In ocular, there is only ocular changes, there are no skin changes. Okay, so these three are important for us, that is erythematous lesions with telangiectasia, papulopustular type, and rhinophyma, that is phymatous type. Okay, so this is the presentation. So whenever question comes on rosacea, you will find it will be written that patient develops erythematous lesions with telangiectasia over convexities of the face associated with flushing. Sometimes this flushing aggravates, so this aggravates on exposure to heat. So sometimes there might be history that this flushing, this redness might aggravate on consuming hot tea or hot coffee or working in hot environment like kitchen. Okay, so this is the common clinical presentation. Okay, so whenever you find a question with this clinical finding, that is erythematous lesions with superficial dilated blood vessels over convexities of the face, and these lesions aggravate on consuming hot tea and coffee, answer will be rosacea. Okay, now in the etiology of rosacea, there is role of a mite, and that mite is Demodex mite, which infest in the pilosebaceous unit. Okay, so Demodex mite, and that is the reason why the treatment of this condition is metronidazole. Okay, so these are the points which you need to remember in rosacea. So you can see here, this is a patient suffering from rosacea, where you will find these erythematous, that is red lesions. Some papules or pustules might also be present, and they are present over which sides? Convexities of the face. What are convex areas of the face? Cheek, nose, chin. So you can see cheek, nose, chin is being involved. Okay. There is a phymatous variant also. So sometimes there might be hypertrophy over the nose. Patient might develop rhinophyma. Now, sometimes when the patient of rosacea comes to you, we get confused with another condition which also present with erythematous lesions over convexities of the face, especially cheek and nose, and that is SLE. There are butterfly rashes of SLE present over nose and cheek. Okay, while here also the erythematous lesions are present. If you closely examine, you will find telangiectasia as well. So this is a case of rosacea. Now many a times we get confused. So how to differentiate them? The first and the most important point, which was also asked in NEET last to last year, that is nasolabial folds. You can see the nasolabial folds involved, spared. This is the most important point. So in SLE, nasolabial folds are spared. In rosacea, nasolabial folds are involved. Okay, so examine the nasolabial fold. Nasolabial fold are spared in SLE, they are involved in rosacea. Another important point is here in rosacea, all the convexities of the face might get involved. So here देखो, see chin spared, chin involved. Okay, then other than this, you will find other systemic manifestations of SLE which might be present in the question, like patient might have fever, arthralgia, then photosensitivity, while here patient will give history of flushing which aggravates on heat. Okay, so with the help of these points you can very easily differentiate, but among these the most important one is nasolabial fold. So examine the nasolabial fold. If they are spared, it is probably SLE. Okay, so if characteristic butterfly rashes are present, well and good, you can very easily identify them. But if you are ever confused, then look for these points. Okay, so with the help of these points like flushing, photosensitivity, other systemic manifestation, nasolabial fold, you can very easily differentiate these two conditions. So this is a case of SLE, while this is a case of rosacea.